Welcome to the Wellbeing at MSU podcast with host Dr. Alexis Travis, Ph.D. Today's episode features the Spartan Wellbeing Collective, fostering a health-promoting campus. Today's guests are from the Spartan Wellbeing Collective work groups across campus and include Dr. Tim Spedoske, MD, University Health and Wellbeing Medical Director, who is the co-chair of the Support for Mental Health, Physical Health, and Basic Needs work group. Tim has been with Campus Health Services since 2016, and he received his MD at Michigan State University College of Human Medicine. As medical director, Tim is in charge of running our healthcare facility, implementing regulations, and keeping the division updated on medical trends. With 27 years of service as a family physician, he is committed to providing high-quality patient care and ease of access to medical resources for the Spartan community. Renee Zientek is Executive Director for the Center for Community Engaged Learning and is co-chair of the Health Promoting Work and Learning Culture Work Group. Renee is responsible for contributing to the development and expansion of community engaged learning at Michigan State University. She is also Interim Executive Director of the Career Services Network and co-director of the MSU Vote Campus and Community Initiative. She earned her Master of Arts in American Cultural Studies from University of Michigan. Shelby Gombosi is Associate Director at University Health and Wellbeing's Resource Center for Persons with Disabilities, RCPD, and is the co-chair of the Service Access and Accessibility Work Group. Since joining Michigan State University in 2008, Shelby has held progressively responsible roles across several campus units before joining RCPD in 2020, where she has served as Psychiatric Access Specialist, Assistant Director, and now Associate Director. She holds a bachelor's degree in psychology from Cornerstone University and a master's in rehabilitation counseling from MSU. Dr. Swapna Hingwe, DOMA, is Counseling and Psychiatric Services Director at University Health and Wellbeing. She is also co-chair of the Belonging and Connection Work Group. Swapna is a psychiatrist, campus mental health leader, and director focused on the mental health and well-being of college students. Her work centers on holistic student health, belonging, and institutional approaches to sustainable mental health care and higher education. Dr. Laleah Fernandez, Ph.D., is Associate Director of Institutional Research and is co-chair of the Data and Evaluation Work Group. Laleah earned her Ph.D. in Media and Information Studies, MA in Advertising, and BA in Journalism, all from MSU. She has published research and reviews in the areas of digital inequalities, advertising, economic development, mobilization, and science communication. Now here's your host, Dr. Alexis Travis.
Hello, and welcome to the Wellbeing at MSU podcast. I'm Dr. Alexis Travis, Assistant Vice President and Assistant Provost for University Health and Wellbeing. Today, we're focusing on collective action across the campus to foster a culture of care and an environment that is supportive of health and well-being. We have some wonderful guests with us today, including Tim Spedoske, Renee Zientek, Shelby Gombosi, Swapna Hingwe, and Laleah Fernandez. Thank you all for being here to lend your expertise and perspective on this important issue. Over the past year, MSU has taken bold steps to reimagine what it means to be a health-promoting university, signing the Okanagan Charter, launching the Spartan Wellbeing Collective, and rolling out its first ever university health and wellbeing plan. Together, these efforts are shaping a campus culture where care, connection, and community are at the center of Spartan life. The University Health and Wellbeing Plan is built around 4 key priorities. Each priority is guided by a dedicated work group and co-chaired by members of our campus community. There is a 5th work group dedicated to data and evaluation. Let's hear directly from those leading the work. So let's start with Tim, or Dr. Spedoske, as some of your patients might be more familiar with. I'd like to start and ask you this question about your work group, which focuses on expanding mental and physical health support and meeting basic needs. What does the work look like, and why does that matter for our Spartan community?
Yeah, thank you. So our work group, which there's actually 3 co-chairs, myself and Jeff McKeegan and John Novello, and then a bunch of really dedicated and passionate people from all around the campus, from really a wide variety of areas, which has been really cool to see. but obviously when you talk about what our priority area is, it's mental health, physical health, and basic needs. And that's just huge. I mean, that's so many things. It encompasses a huge swath of what it means to be healthy. And so when we think about health in all policies, health in all areas of the university, it's a little bit daunting with the scope of this one. So what we found is that we've had to narrow it down. But the work, what it means to the students, faculty, and staff is that we're trying to find ways to improve both mental health, physical health, and access to basic needs so that students, faculty, and staff can thrive. What we've found is that narrowing down the work and finding something that's kind of appropriate for the Spartan Wellbeing Collective. And what I mean by that is there's good work that's done around campus every day. And like, for example, in UHW, University Health and Wellbeing, we are focused on mental health, physical health, and basic needs every single day. But what the Spartan Wellbeing Collective allows are things that really go beyond just expanding or optimizing the work that UHW is doing. And so each kind of subgroup, we've broken out into subgroup because so many people are interested in this, and each subgroup is working on one of those different areas. And some really unique things have come about because of it. And it's really been a result of the particular people in those groups and the expertise that has shown up in the areas around campus that have been represented. For example, the physical health group, there's been quite a focus on rec sports because we have some great rec sport representation, and how can we kind of leverage rec sports to increase people's physical health and activity, which obviously has impacts on their mental health as well. The mental health group is working on stigma reduction and ways that we can decrease barriers to services, because the university has wonderful mental health resources, and so it's a matter of getting people to be aware of what's there and decrease the barriers to actually receiving that care. And then same with basic needs. Basic needs, there's a lot of good work being done. The Spartan Shelf, for example, again, which is part of UHW, is doing amazing things. So part of what we're looking at is how can we expand that throughout all of campus and maybe having sort of micro closets, small areas where there's little outposts of basic needs support for people so they don't have to go beyond their college in order to get some of the things that they need, whether it's food or toiletries or warm weather gear or whatever it might be. And again, this is all bubbled up from the people in the group, and it's just been fun to see, but important work to expand beyond just what one particular unit is doing.
Yeah, that's that collective impact, right? It takes all of us. It sounds like you've got some great people working on this in your group, and I appreciated what you said about kind of narrowing it down, because we're a very large university and they're all complex and different diverse needs. Around that, we also look at data, right? And so when we look at the health and well-being assessment and the survey that was done, we see in the data that 1/2 to 2/3 of our Spartans said that they're concerned about how their stress impacts their health. Can you talk to me a little bit about, is your group focusing on that? And if so, what are the pieces that they're advancing to address that?
Sure, absolutely. I think that each area is actually has an impact on people's stress level, clearly when you break those three bits apart and you look at the basic needs aspect of it, of course, students who aren't having their basic needs met or are worried about what their next meal is going to be or have food insecurity, that's just a tremendous source of stress. So the basic needs group, of course, is sort of indirectly dealing with ways to reduce stress around campus. Mental health, of course, that's sort of what the mental health group is about, is looking at anxiety, depression, and a lot of it really is not so much is there a program or a thing that can be done to sort of directly impact people's levels of stress? But if we can get people to have better awareness of the things that already exist that can reduce anxiety, and that's not just the mental health services, for example, at UHW, but there's a wide variety of things happening around campus. One of the themes, and it might be a theme that you'll hear from other people, is there's so many great things happening, but how do we make sure people know? I actually interacted with a student today who showed up with a cut on her finger, and as I was evaluating it and talking with her, she's a third-year student. She's been here 3 years, and I said, have you ever been here before, to Olin? And she said, no. And I said, well, if you need to follow up on this, you get 3 free visits. And she said, oh, 3 free visits? I didn't know we get those. Again, it's something that maybe somebody who's experiencing significant stress and knew that there was no cost to come and talk to somebody in CAPS or somebody in Campus Health Services, that would be a stress reducer for them. But the awareness isn't there. So an awareness campaign and the stigma reduction campaign is part of that as well. And then physical health, again, especially with our rec sports folks that are sort of leading the charge on that. There's lots of aspects of physical health, but the idea of activity and exercise and the way that kind of plays into stress reduction is well established too.
Interconnection of these things. So let's move to Renee for a moment. Your work is focused on fostering a culture of care. So central to the Okanagan Charter, this will be a culture that supports health and well-being while promoting equity and inclusion across our working and learning environments. So both and, right? It's really thinking about students, but also faculty and staff. How are your team approaching this work?
So I have another co-chair as well. So Annie Thompson is a co-chair with me for the Health Promoting Workgroup and Learning Culture. And we've been really focused on how we can move well-being from programmatic to culture, and thinking about how when policy and leadership and classrooms align, there's an opportunity for that culture to shift. So we've started our work in a couple of unique and impactful places. One is thinking about health in all policies. So our work group has been committed to embedding health and well-being in university policy decisions and creating a practical checklist for people to use in that type of setting. And we want the well-being to be considered at the beginning of the policy development. That's come across really strong from our committee, is thinking about, as policies are being developed, how can we front load the concepts of well-being here on campus, not have it be an afterthought. We've also been working on leadership and supervisor training. And so in that space, the work group is really focusing on increasing leadership capacity, or supervisors even capacity, to create supportive work environments. Creating a training, perhaps, that these are things that are being explored, could really help to make sure that those who are leading units and divisions and teams are able to create a work environment that is supportive. We've been thinking about, too, how what leaders do and what they model really shapes the culture. And so starting in a place where you're providing that kind of training can have a snowball effect or a positive effect. We're also focusing on pedagogical well-being, and so we are working with university health and well-being, and also thinking about how it is that we support faculty so that they can have inclusive classrooms and they can embed well-being directly into academic experiences. And so as we have moved forward with our work this year, those are the spaces that we've been working in, trying to create that culture of care, again, across the campus with faculty and with students and leaders here as well.
I'm really excited and glad that you mentioned the pedagogical well-being piece of this. When we talk about health and well-being, we talk about weaving it into all aspects of Spartan life. So it feels very appropriate that we're getting into that learning space and making sure that it's really embedded there as the core of our institution. Also, I wanted to think about the data for a minute. with only about 50% of our Spartans feeling like health and well-being is a priority, and then also knowing that we have so many different dimensions of health, including spirituality, right, which often kind of is a little bit more challenging or sometimes gets overlooked. How is your work group approaching that?
Well, I mean, I think as Tim mentioned, there's so many resources that are available, and so sometimes it seems like even as the survey revealed, folks not knowing about things is part of the issue. So some of the work of our work group is really focused on messaging and visibility. So thinking about how together we have coordinated campus-wide communication, how we, again, with leaders, make sure that there's consistent messaging. Some units know more than other units because we need to work a little bit on how to provide that consistent messaging. And being able to make those services available across all MSU spaces, right? So not just here on our main campus, but satellite locations and in remote environments too. The spiritual well-being question is something that our committee spent quite a bit of time on, and to us, that includes things like purpose, meaning, values, ethics, and direction. So we're really trying to explore more opportunities for there to be reflection and dialogue, connection, and support across diverse traditions and perspectives. So that's a space where spiritual well-being is so important. When people feel grounded, they feel connected, and they feel aligned with what matters most. And so we're exploring how to make that possible for people. How do we bring those things, purpose, meaning, values, to the forefront for our Spartan community?
Thank you for sharing that framework as to how you're approaching the spirituality work. It definitely aligns with kind of how we're looking at whole person, right? And looking at the whole Spartan. Thank you. Shelby, switching gears a little bit, your work group is focused on improving access to services and ensuring accessibility standards are consistently being applied across the university. What kinds of conversations has your team been having about this work as well?
So a lot of the conversations that we have had are around the need for access to services and how critical it actually is for student and employee success, right? Access is the building block, the foundation for success in anything that we're doing. Students and employees are coming to MSU with varying backgrounds, different experiences, different histories, oftentimes away from their primary support systems, right? We bring in students from all around the world, we're bringing in faculty from all around the world, and they're leaving their support systems behind to come here. MSU is a self-contained city-like structure where students are learning to navigate life for themselves for the first time. That means connecting with supports for the first time that oftentimes parents or caregivers used to do on their behalf before they got here. That might be scheduling doctor's appointments or even just recognizing their own need for support that they've never had to do before. Somebody might have cued them into that. So the need for additional help, academic, emotional, physical, or mental health, where somebody else might have recognized that need for support and identified it for them, students are now doing on their own, right? At the same time, faculty and staff are playing that supportive role for students in addition to their primary role as instructors or administrators or whatever that role is, right? So we're bringing in a lot of folks from all over and putting everybody in a space where there's multiple roles to play, many hats to wear. At the same time, students and employees are inundated with messaging from entities all across campus, right? So parsing out what is the actionable information, especially when there is that need for support, when a student is in crisis, when a faculty or employee, or when an employee needs help, can be very challenging. The information is there, accessing it can be difficult. So much of our conversations have centered around how information is currently being disseminated and absorbed by the receiver, and then other ways we can cut through that noise, the noise of a large institution, so that the Spartan community can have a clear path to accessible services. We're looking at the best ways we can communicate and reinforce regularly the services that are available to students and employees alike.
I'm hearing a theme emerging from the conversation. There are so many wonderful resources, but the challenges around awareness and making sure that people are able to access them, whether it's through help seeking themselves or referral from others on campus. To that end, only about half of the Spartans who were surveyed said that they know where to go to if they're concerned about their mental health. So from your perspective, what are the barriers, whether it's cultural, structural, logistical? What are the things that might prevent a student, faculty, or staff from seeking that support, whether it's through CAPS, whether it's through RCPD, or through campus health services?
So I think the barriers that you've identified are all part of that, right? I think it's a little bit of all of it, but I think it's oftentimes about capacity, stigma, and that access as well. Students are trying to maximize block tuition scheduling to get the most out of increasing tuition costs, right? So they're taking on full loads, 15 or more credits each semester on top of classes. They have study groups, homework, exams, student organizations, other activities that are not part of their academic program but co-curricular in nature, that they're required to do to set themselves apart to get an internship or to get into graduate school or to land the job they're looking for after they graduate. Employees, similarly, are dealing with increasing enrollments, right, without increased staffing, reduced budgets, increasing workloads, so that stress level is increasing. So capacity is a huge barrier to being able to access services in a situation where there just doesn't seem like there's the time to be able to do so. Finding that time and capacity to connect with services is probably one of the biggest challenges that I've been able to see as part of our work group. A lot of them also our services are available at the same time a lot of our employees and students are in class and working. And so accessing services can be a challenge. And then add to that on top of it a cultural or perception of stigma that exists already. And you've got sort of a recipe for not accessing services that are available and waiting to help, right? So on top of that, as Tim has mentioned, as Renee has mentioned, there's information overload too, where there's how are people finding out about this, and how are we accessing that information to even get to the services? So I think it's a little bit of all of the above with that. There are a lot of different barriers to access that we're finding.
Yeah, we're coming up to the second summit for health and well-being on campus. And so when I think back to last year, and I think back to the student panel, some of you might remember, the student said, well, we get so much information, but we don't have the information that we need.
Yeah.
And so we're still trying to address that challenge, which I'm so glad was articulated. And yet we haven't quite figured out what's the secret sauce to get people the information that they need in the way that they need it at the right time. And so we endeavor to continue that.
Yeah.
Swapna, your work group is focused on creating environments that foster connectedness and belonging to strengthen our social health. The survey, the University Health and Wellbeing Survey, showed that 50% of our students, faculty, and staff feel like they belong at MSU. So you can say conversely, there's 50%, unfortunately, feel like they don't belong. So how is your work group approaching that challenge?
So I think first, when we hear the 50% of our community doesn't feel a sense of belonging, I think one of our work group's first responses was just to ask what that number is actually telling us, because we're thinking about such a broad community of students and staff and faculty. And then what are we actually measuring when we're talking about belonging? So we did our work group, had a lot of really active conversations defining belonging, connection, social health, making sure we were clear on what we were going to try to operationalize so that we could then move forward with some ideas and some planning. Even doing that, though, the scope of the work is huge because of these very different populations who have different needs related to belonging. But I think the important thing that we have settled on, at least for now, is that we know that belonging isn't created by slogans or by just programming alone. It's really shaped by daily experiences. So, whether students feel seen in their classrooms, whether staff feel supported by their supervisors, do people feel they can express disagreement safely? Do people feel respected when they show vulnerability? So these are definitely, I'm listening to the others talking about their work groups, and these pieces, the connection and belonging and mattering, are definitely harder to define, but are also a part of all of the other work groups. So how are we trying to approach this? I think, we're thinking of belonging as aspirational. That's the ideal, right? That's what we want people to feel. But in order to make that happen, we have to create practices that connect people. So we have really been focused on the connection piece, and then we're hoping that we will get to the mattering piece where students and staff and faculty feel that their voice matters or that their contribution is meaningful. So it's ambitious. It's a lot to take on, but I think we're just trying to focus on conditions at MSU instead of focusing so much on the outcome. And what I mean by that is is the soil the soil we need? So do we have the structures and the policy and the leadership behaviors that are going to strengthen our soil or erode our soil, and soil meaning belonging. And so what we have settled on for now, because I think we were really thinking big and broad and then really had to figure out, okay, what do we want to focus on? And so we are focused on staff and faculty currently because we know that this project is going to span several years. And so that's how we could actually let ourselves get comfortable with focusing on just one part of this population. So we are also looking at supervision, and this is an overlap that we just recently discovered, which is fantastic because it shows that the work groups have some synergy in terms of what we're looking at. So we're looking at supervision. We're looking at mentorship and coaching programs and potentially developing that, but first looking at what's available on campus, informal and formal. And then we are also spending some time looking at broadening our definition of professional development. So these are the 3 different subcommittees of the work group. And I would just say that with all of these areas, we're looking at accountability, how decisions are communicated, psychological safety. And the reason we're looking at these things is because this is how people feel a sense of belonging, connection, and mattering is when these principles are in place. So I guess I'll just say that we know that we can't impose belonging on groups, and so we really want to try to elevate voices from across MSU's population to try to understand what different folks need to feel that sense of belonging.
So I'm hearing, again, another very broad area and maybe some of the narrowing that we heard from Dr. Spedoske as well, in that you've chosen to focus on faculty and staff. I also heard you talking about measurement as well, and that naturally leads us into the final and 5th work group. But before we do that, I'd like to ask you about kind of the climate today. So we live in this digital world, and we know that impacts like our students and how folks interact and communicate, as well as our faculty and our staff. The interactions often feel fragmented, and the climate often divisive, unfortunately. So how can we, as a university, create spaces and opportunities that genuinely bring people together and strengthen community?
This is a big question. It is a big question because digital connection has expanded access in so many ways, but it's also made it easier for us to stay in our bubbles or our silos, especially on a campus this big. And so I do think that universities have a unique opportunity and also a responsibility to create environments where people can actually encounter difference with some support. As opposed to defensiveness. How we do that is a little trickier, but real community is built through sustained dialogue and shared problem solving and having these spaces where people can disagree respectfully, without fear. So one of the things that a university actually has that I think a lot of communities don't have are what we call third spaces. And I think, culturally in the U.S., it's not a culture where we have a lot of third spaces naturally. So when I say third spaces, I'm talking about, your first space being your home, your second space being work or school. And then I think what we have the opportunity to do on a campus is to actually really create third spaces for students, for faculty, for staff, spaces, and they can be digital, but it would be nice if they're not digital. Spaces where people can share and be in community and connect without it being evaluated or linked to advancement or a grade, but just space to connect. And I think, again, a university has a lot of opportunity for third spaces. So I think about the Multicultural Center, for example, which I think that's what it's really turning into, is a third space. And I think students find ways to create third spaces. I think for staff and faculty, we would have to be more intentional about creating those spaces. But we have to be intentional. Again, we can't assume that the spaces will just happen organically. And so I guess I'll stop there, and I'll say there's a lot of opportunity to bring people together digitally, but then to sustain the connection, I think we need to find these other spaces.
Mm-hmm. Yeah, so maybe some combination of the two, allowing for choice. I think you mentioned third space, and that's been a topic of conversation that's come up a lot, even on the MSU campus and for university arts and collections. I recently heard of the MSU Museum becoming a third space for some students. And so I guess in a lot of cases, students will kind of self-select the spaces that feel most comfortable for them. And sometimes it might not be the space that we intuitively think would be where students would like to spend time. And so I guess asking and being willing to engage in those conversations will take us to that next, opportunity. So Laleah, last but not least, your work group is focusing on metrics, data and evaluation. Can you tell us why metrics in the UHW plan are essential for understanding what's working and where there are opportunities for improvement? How is your work group focused on data and evaluation approaching the challenges of efficiently measuring the impact of these strategies? And I also want to acknowledge here, this is a very large ask.
Well, great question. Thank you, Dr. Travis. I'd like to start by saying that our group is a smaller group of very passionate data enthusiasts, and we were created solely to support the work that is going on in all of the fantastic work that we've heard about in these various work groups based on priority areas. So at its core, metrics are essential because they translate this very ambitious aspiration into accountability. Now, in the University Health and Wellbeing Plan, we have very clear outline of these priorities, but we also need defined indicators to determine if our strategies lead to measurable and meaningful change. Metrics allow us to establish baselines, track trends over time, and identify disparities, just to name a few. Our approach in the data evaluation group, work group has been phased. So we began by clearly defining scope and deliverables in priority areas rather than just treating evaluation as an afterthought. And I've heard that echoed throughout some of the conversation already today. So building those metrics and evaluations into the development itself is crucial. We're currently moving from planning into some areas of early operationalization, and our goal at this phase is efficiency as well as clarity and eventually actionable insight. We're not just looking for more data. There are plenty of data. So this includes, for us within our work group, finalizing priority-aligned metrics and looking at how we might create dashboards for transparency, again, coming back to that accountability piece. And based on the identified priorities and definitions produced within the 4 work groups that we've heard from, we can then guide the development for specific metrics.
As we think about this, because you've mentioned a few things that deeply resonate with me, we're not just looking from our data, right? We want data that is going to tell us something that is actionable, that helps us to improve health and well-being on our campus, or improve service, accessibility, or even just the supports and spaces that are available and accessible, so we get to that feeling of belonging and connectedness and mattering, right? So all of these things. So beyond just tracking the outcomes, evaluation can really highlight some of the needs and the gaps that exist in a community. And to that end of using this data and understanding truly what the opportunities are, what kinds of measures or feedback loops are you using to, for want of a better word, validate what we're hearing and what we're seeing in our data for students, faculty, and staff?
The only way that we're really going to have a shot at even beginning to measure lived experience will require feedback loops in various forms and fashions. So, for example, it will be essential to look at mixed method assessments, so pairing some of the survey data that are already existing or planned surveys with focus groups and listening sessions to really get that context. Otherwise, we're just looking at numbers and we won't know the why. Multiple levels of analysis will be crucial. So we need these multiple levels of analysis to drill down to try to identify clues that inequities exist. And those clues will be lost in the aggregated data. So we really want to think very deliberately about those levels of analysis. Kind of relatedly, program level evaluation and creating templates. So our group is currently working on some standardized assessment tools to help embed into each strategy area so that the work groups can collect comparable and implementation data. So we're measuring what we think we're measuring, and we can have that conversation across the work groups. As I had mentioned before, transparency, and more specifically, we're thinking about transparency through reporting dashboards. This is one way that stakeholders can see the progress and hold us accountable when things may identify those gaps that you had mentioned or that we anticipate. And then potentially working with campus partners to include questions in planned surveys or developing other types of rapid feedback tools, short cycle instruments to allow quicker pivots if we seem to be going off course or find surprises, which I'm sure we will along the way. This allows us to respond to emerging issues in near real time rather than waiting for the end to look at pre and post evaluations. In other words, evaluation shouldn't just be retrospective. It should function as a continuous improvement engine. And when we identify those gaps, we will be able to, as a group, feed that information back into the work groups so they can adapt the strategies accordingly and in alignment with their conceptualizations and understandings of these very important issues. So again, the feedback loops are critical throughout.
I just loved what you said about continuous improvement engine. Being from public health, evaluation is one of our many languages, and I think that what you've described is a way that we will make sure that we get to that aspirational goal. Because it could seem, pie in the sky, like these are huge things we're throwing out there. So I love that the group that you are working with, data and evaluation, will be doing that evaluation in live, in real time, and help us to be able to course correct, to see immediately what's working, what's not working, and how we can get there. This question's for everyone. Across your work groups, access to resources, whether mental health services, basic needs, or inclusive environments, comes up again and again. What do you see as the biggest barriers to access, and how can MSU collectively break them down? And I know some of you have spoken to these themes a little bit, but really just wanted to come back around to this because I'm sure you may have other input.
I spoke on this a little bit earlier. I think capacity is a huge barrier. And I think also a lack of knowledge of resources, not because they're not being communicated, but because getting through all of the communications that are coming when there's an actual need for those services can be difficult, it is one of the barriers. I think one of the ways to address that can be the best appropriate education to the campus community. Defining that, though, is kind of where all the work groups are at right now in figuring out what that might look like. So I think that it's a little bit of both. So even when we get to what that educational piece might look like and how we can figure out how to kind of cut through everything to get to that information, we still have to have the capacity to absorb that information.
Mm-hmm. Both ends.
Yeah.
Mm-hmm. Sure.
And I think I might add that another barrier is the complexity. And I know we've already talked about complexity, but I think it's not just that resources exist and people might not be aware of them or don't have capacity for the information. There's also structural inequities that might play a role too on campus, just who gets heard, who feels welcome, whose needs are prioritized. And so this is something we've been thinking about a lot, and it sounds like you have too in your work group, about access in terms of visibility, but also approachability. So not just having the services, but making sure that they're trusted, discoverable, because there's so many scavenger hunts you have to go on campus to find things sometimes, and making sure they're equitable services too.
Mm-hmm.
Yeah, the scavenger hunt aspect it resonates because just as we were even investigating the work that we were going to embark upon, whether it's the basic needs and quantifying what's even available out there, it was hard for us to find that information. People well connected with the university and with the resources to be able to come up with, okay, this is what we know exists and where it exists, and certainly in an easy to find place it was a challenge. It was a challenge for us, so it certainly gave us a good reason to feel for any student who might be searching for that same information.
Yeah, that's one thing that, in my regular work that I do is if I look at something and I say, well, I've been on this campus for X number of years and I can't figure this out, how is an incoming first-year student supposed to know this?
Exactly.
And that's what gets really difficult.
Yeah.
So.
I think I could add to that too. I think as far as we've come as a society, that stigma is still a barrier. And for students, time constraints still barriers. And so it's like thinking through the coordination and the messaging and stronger partnerships to get students to the resources is something that we'll want to be thinking about moving forward.
I also think there's an aspect of this that's we often, as human beings, just don't pay attention to things until we have a felt need for those things. And I think at this university and probably everywhere else, we think, oh, new student orientation, or we'll just throw all this information at people. And we say, well, we told you once, and so that notion of, really the information being there when somebody realizes that they might have a need for it and having it be easily accessible there instead of just saying, well, I'll tick the box because we told them something at new student orientation or in some sort of communication one time.
Yep.
Yeah. Yeah, at minimum, 7 different times, 7 different ways, right? To keep repeating, even though sometimes it might sound redundant, is really important, especially like you think about NSO, it's great and it's wonderful and a lot of thought goes into it. And also people are drinking from the fire hose. Same thing as new employee orientation, right? You want to take in as much as you can, but everything's new. There's a million acronyms. There's just, you're trying to really just figure out where am I and what's going on. And so as much as we can be mindful of that, I think is really great. So many priorities emphasize inclusion and belonging. And so that's really a lot at the center of the work that we do. From your perspective, and anyone can answer this, what does a truly caring campus look like? And how do we ensure all voices, especially those who are marginalized, are heard as we work towards that vision?
When I think about this question, I think about people feeling seen and valued and supported, not just when there's a crisis, but all the time. And so that aspect of culture of care is an important thing, I think, for us all to focus on. And it's going to take, the whole campus to really think about how that happens, how we bring that culture to folks where they do feel seen and valued and supported.
Again, it goes to that intentional. A few people have mentioned that.
And I was talking about this a little bit yesterday during Ethics Week. I talked about the ethics of belonging. And one of the things that I was saying is that it's a pattern of interactions, and sometimes it's really just the consistency of the mundane interactions, because they are mundane, but they're still intentional. Check-ins, communicating transparently, recognizing someone's effort, really integrating well-being into your daily work and not just as an add-on. But if you do those things consistently, I really think that that's how we all can contribute to a culture of care on campus.
Yeah. I often, as a woman of color, I often talk about repeated positive experiences, right? So when you enter into a space or if you go somewhere, if you have repeated positive experiences, then it kind of builds trust, it builds that sense of belonging. But if you have a negative experience, then that kind of removes you from that feeling of belonging, and it may take many, many, many more times to have positive interactions for that to be restored or for that perception to change and shift. And so I think about that in terms of the health and well-being journey, and as we think about belonging and connection a lot. Okay. Embedding health into all policies and practices requires leadership at all levels. How can faculty, staff, and student leaders integrate well-being into their core responsibilities, and how can we best support them in making well-being a natural part of everyday campus life?
I mean, one of the first things I think of is that in letting employees know that it can be part of what they think about. Just even opening it up as a category of things that are part of their daily work is thinking about the environment of well-being and in the people that they work with and around, and particularly as leaders around this campus, just having that lens, and us, with things like the Okanagan Charter and Spartan Wellbeing Collective, sort of raising up the notion of health and well-being in all aspects of the university. As people hear that, hopefully it triggers even just the beginnings of awareness. I don't know necessarily that it would create proficiency immediately, but even just the awareness that it should be something they think about.
I really liked what Renee had to say earlier in terms of leaders modeling those behaviors. And then building up on that idea from a data perspective, campus leaders, faculty, supervisors, and even student leaders can take some more tangible steps as well. So this might look like reviewing available well-being data that are relevant to their unit or experiences, collecting feedback following events or initiatives to get some of that qualitative feedback, or asking explicitly how policies or practices may impact well-being in the process of developing those, not just reviewing them. And maybe most importantly, really normalizing the conversations around stress, workload, and belonging. In the conversation that we were just having about belonging, one thing that strikes me is, or barriers, one thing that strikes me is sometimes we believe that a resource exists. Is that a way for us to then under-resource that resource? Or do we have a mechanism to ensure that it's working the way that should. And that's going to require a lot of sources for feedback. And
Yeah.
I know I'm really excited about the possibilities of the work groups working together. And so Swapna mentioned that we sort of stumbled upon that we're working in a similar space around leadership in a good way, different dimensions of it, but definitely an opportunity to work together. And I think when I think about the possibilities for leaders, one of the things that has come up in our committee is that it's difficult for leaders sometimes to create an environment of well-being or create the culture of well-being when they're not really sure how to take care of themselves first. And so thinking about how we work together in those spaces will just make improvements for everyone. So thinking about things like setting boundaries or taking, how important movement is on your lunch, not feeling guilty when you have to take care of yourself. And those are all things that leaders can model. And then also, hopefully, if we can come together and create that environment for supervisors and leaders, they can pass that on. So.
Yeah. So I love that you mentioned that and you elevated that opportunity for leaders to take care of themselves, because I'll tell you from around campus, I know that's a challenge. And it's a challenge for all leaders everywhere because of their responsibilities, but also, I think giving people permission and also encouraging people to model that, then it trickles down into all aspects of the organization. So as we prepare to wrap up our conversation this afternoon, I'm going to ask you all, what is one practical step that people can take to foster a culture of care in their own spheres?
Giving yourself permission to take care of yourself, which can be really difficult, both as a leader, an employee, and even a student, right? Recognizing that there is the need to take care of yourself so that you can then pour out to others. Can be very difficult. So that one practical step that you could take is to take a step back and realize that you need care too sometimes, so that you can then care for the folks that you are working with.
Care for yourself and everyone else. That is an Irish proverb that I brought back from Limerick.
become involved with the SWC efforts. If this work is going to be successful, it can't be siloed. So there's a little bit of a paradox in that question. We need more units, more individuals, more representation, more perspectives, because when all of these are brought into the conversation, the data becomes stronger and the solutions become more practical and the impact more sustainable. But how we get there takes each individual to take that step forward and engage the best that they can, whatever that looks like.
Yeah.
I think something I have shared already, but it sounds so simple, but just intentional check-ins with yourself, but also with other people, with your colleagues, your staff, your students, or your peers, whoever that might be, just finding regular opportunities for reflection and connection whenever you're in a group or even in a pair. And I think sometimes we assume things about other people instead of doing those intentional check-ins. And so it sounds so simple, but I think we all have to practice it.
Yeah. Well, and I was going to say something very, very similar in that, yes, that first, making sure you're caring for yourself well and modeling that for the people around you, but then just much in the same vein, but just pay attention. Pay attention to the people around you. Notice if someone seems to be struggling. Notice where they're at. Notice if they're joyous about something and connect with them about that. I think there is great power in that, and it goes exactly with what you were saying, Swapna.
Yeah, I really appreciate the check-in comment, Swapna, because I know on many agendas in the spaces that I work in, check-in is the first thing in a meeting. And most people will look at that and say, it's the check-in. But there's always something that comes from that sharing and reminding each other that we're a team and that we're there for each other, and to hear about what's happening with, the parameters of what people want to share personally and professionally. Really helps to create that sense of belonging and that culture of care. So I really appreciate that you raised that up.
Yeah. less assumptions, more proactive checking. So, as Laleah, you had mentioned, folks should get involved in the Spartan Wellbeing Collective. That takes some time. And so I'm wondering if any of you have just a word or a note or why people should take that time and get involved.
So we really need to, we need representatives from all across campus, particularly, as I had said before, in thinking about these different levels of analyses and different approaches to metrics. So, for example, if we're going to get equity indicators, we're only going to see disparities in access or outcomes across different groups or situations if they're able to come to the table and have a voice heard, and those and we're calling for those voices, and so that would be one reason. Another reason from a data perspective is really trying to think about process metrics. This would be some things that are related to policy adoption rates, training completion, messaging reach, things that I've heard echoed throughout this conversation today, and to find individuals who have historically not been able to have their voice heard. This is our time to not only hear what you're saying, but implement it into the process. And with that comes sustainability. So we're hoping for a long-standing impact and customized services so that we can continue to function and build as a healthy campus.
Thank you.
I would also just add that being involved is how you are. This is your opportunity to have your voice heard while we affect change on campus.
Yeah. I think that's a good note to end on. This collaborative work actually centers elevating Spartan voice. We welcome you. Come join us. Come participate. Get involved in the way that feels comfortable for you. So I want to end by thanking our guests for sharing their insights, experiences, and the work that they're doing to support students and the greater Lansing community. To our listeners, thank you for joining and for spending time with us today. These conversations matter, and your engagement helps move us closer to the campus where well-being is a shared priority and students, faculty, and staff are supported and cared for. I'm your host, Dr. Alexis Travis. Until next time, take care and check in on someone today.